High yield Parkinson's for step one. By the time most Parkinson's patients notice their first tremor, they've already lost over 60% of their dopaminergic neurons. That's because the brain is fighting back. It has compensatory upregulation of the dopamine receptors. It increases dopamine synthesis and even slows the reuptake to stretch every last drop. And in this prodromal stage, symptoms like constipation and subtle motor changes are the only clues. So a patient can look normal, but behind the scenes, their substantia nigra is shrinking, and the neurons are pushing dopamine signaling to its limit. That early adaptation is the brain's desperate attempt to delay the Parkinson's from fully revealing itself. All right, so you could see REM sleep behavior disorder, orthostatic hypotension, and let's look at a practice question. 62-year-old woman at risk for Parkinson's, no tremor or rigidity, constipation, orthostatic hypotension, and hand dexterity changes. Imaging shows 50% of the atrophy. What compensatory neuronal change is taking place? It's upregulation of the postsynaptic dopamine receptors. And students are like, wait, this is weird. Why is it upregulating? Well, it's a compensatory mechanism, and that's super high yield on step. What's happening, and as a compensatory mechanism? Is the RAS activated? Is it hyperplating? Like just different malignancies can cause different reactions, and you have to be mindful of those. Dopamine receptor blockades, those are seen in drug-induced Parkinsonism, so like antipsychotics can block the D2 receptors. Increased synaptic dopamine, that's not long-term overall, it's still going to be low, even though the reuptake is downregulated. Normal dopamine transport, no, it's going to be downregulated. Preserved nigrostriatal volume, that would not be true. It's already been decreased by 50% in this patient, and in fact, by the time you notice the first tremor, it's already going to be depleted over 60% of your dopaminergic neurons. So if this is helpful, then like and subscribe.